Plus, RFK Jr. securing a key vote in his bid to become HHS secretary. Is he the disruptor U.S. healthcare needs? Dr. MAHA joins us with her take.
RFK Jr. on track for confirmation as the Secretary of Health and Human Services after clearing a key Senate Finance Committee confirmation vote. He was one of President Trump's most controversial cabinet picks, but there is a large group hopeful that he could bring much-needed change to American health care. Let's bring in Dr. MAHA, board-certified physician in rheumatology and internal medicine, to talk more about this. So a lot of people in the medical community, and a lot of politicians on Capitol Hill for that matter, concerned about what RFK Jr. might do if he becomes Health and Human Services Secretary, including on vaccines. What's your take? You've been watching all this.
So, John, thanks for having me. Those that are concerned are primarily concerned because he is very influential on public health matters.
Sure.
People want to listen to him, and they are concerned that if he raises concerns about safety of vaccines, then there might be a decrease in vaccine rates, leading to just kind of an erosion in trust of the population, and possibly rise in some preventable diseases popping up again. So the concern really is around safety.
Right. So there are a lot of people in this country who agree with him on certain things, and that is that there's an epidemic of chronic illness in the society. Much of it brought on by lifestyle and what we eat. Listen to what these moms told us.
Make America Healthy Again movement is an answer to my prayers.
My children were sick. All three of them were super sick in 2007 on many chronic medications, and I was told they're just going to need to be on chronic medications forever. And I just refused to take that answer for one more day. So I started changing our diet. I changed our lifestyles. All our kids came off medications.
And this is something that President Trump posted on Truth Social the other day. He said 20 years ago, autism in children was 1 in 10,000. Now it's 1 in 34. Wow. Something's really wrong. We need Bobby. Thank you, DJT. You see a lot of illness in your practice. How much of it do you think in this country, the chronic illness that we suffer as a nation, is because of lifestyle, because of what we're eating? Because we eat so much processed food.
I am seeing an abnormal amount of autoimmune diseases. I'm a rheumatologist. Every day, there's a growing number of autoimmunity in the country, and it's tripled over the past couple of decades. It's definitely alarming, and it's not related to our genes. There's something in the environment. By 2060, there is this projection that the rate of Alzheimer's disease and dementia will double. We know that 70% of our young adults are unfit to join the military, primarily due to obesity, and this is a national security concern. And the rising rate of cancer, especially in young patients. So there is something in the environment, and I think that Mr. Kennedy is very correct in that he's trying to get to the root cause of this, and he's narrowed it down, in my opinion, correctly down to our food exposures and to our toxic environmental exposures.
So the FDA just recently said that it was going to ban red dye number 3, one of a number of food dyes that we use in this country. A lot of people have said, well, if you look to places like Canada, if you're making a cereal like Fruit Loops, they use things like watermelon dye and blueberry dye and other vegetable dyes to make the colors. They're less vibrant than what we see here, but they're much healthier. And a lot of people say that they taste better.
They absolutely do. A lot of people who have traveled to Europe can attest to that. They love the food. It tastes more like real food. And you know, John, today there are 10,000 synthetic food additives here in the U.S. in our food supply versus only 400 in Europe. And what happened is I think there was a policy in the 1950s that FDA set out. They wanted to streamline or fast track some common household food additives. And then Big Food figured this out. It was a big loophole, and that's how we got an influx of massive toxic additives. I think this is an area where policy will be heavily focused on changing, and hopefully we can expect a lot of additive bans coming soon.
All right. Well, we'll see what happens with the RFK confirmation. The vote will be coming up in a few days. He doesn't have the support of all of the Republican Party at this point, but he may squeak through. Dr. Tirani, great to see you. Thank you for coming in today.
Thank you for having me.
Appreciate it.